Good afternoon. My name is Kadest Lulu. I'm Secretary of the Ethiopian Public Health Association's Executive Board and Mistress of Ceremony for this opening ceremony today. I'm really honored to get the opportunity amongst you all to introduce today's program, and we will start by delivering a very warm welcome from the EPHA through the President of EPHA, Dr. Metike Molla, who is also Vice President at the Addis Ababa University. And then we will have keynote addresses from EPHA's esteemed partners, including Ms. Denia Gail, UNFPA country representative, Dr. Buremia Sambo, WHO representative, Dr. John Kang Song, Director of Africa Center for Disease Control and Prevention, Africa CDC, and Mr. Stephen, Country Director of US Centers for Disease Control and Prevention. And then we will have the official opening by Her Excellency Dr. Liat Addis, Minister of Health of the Federal Democratic Republic of Ethiopia. And then we will have the long-awaited EPHA Award ceremony. Dr. Metike will lead that, and then it will be closing and wrap up. So as all of us know and hear every day and every time we use our phones, COVID-19 is claiming lots of lives. And I would like to remind every one of us to take precautions, keep our social distancing. And I really don't need to tell this esteemed gathering about hand washing and sanitizing ourselves, but please let's take care of ourselves and those around us. I will now call upon Dr. Metike Molla to do the welcoming address. Thank you.
Thank you, Dr. Kadest. Your Excellency, Dr. Liat Addis, Minister of Health, Federal Democratic Republic of Ethiopia, Dr. Yohannes Chala, Head Addis Ababa State Administration Health Bureau, Dr. John Ikengasong, Director, African Center for Disease Control and Prevention, Dr. Tawabesh Bishal, Secretary General, African Federation of Public Health Association, Ms. Denia Gail, Country Representative, UNFPA, Dr. Burema Sambo, WHO Representative to Ethiopia, Dr. Freyot Sheto, representing Centers for Disease Control and Prevention, Ms. Emsrach Balaina, Country Advisor, the David and Lucy Packard Foundation, members of EPHA and representatives of the General Assembly, members of the executives of the General Assembly and Executive Board, invited guests and representatives of partner organizations, the media house, ladies and gentlemen, all protocols observed. First and foremost, I kindly ask you all to stand up and hold a moment of silence in respect of the late members of EPHA since the 13th annual conference in the past 2 years. I'm calling the names. Professor Mekonnen Asafa, Professor Fukroin Kusalase, Mr. Gabramanil Taka, Professor Melke Idris, Mr. Wudeneh Birru, Dr. Masaresh Shifarao, Dr. Gebrselassie Kobakzi, Mr. Gashaw Mengestu, Dr. Jonas Getachew, Dr. Masresha Bahoy, Mr. Deresa Hailu, Fisahaye Alamsaged, Dr. Tafara Wande, Dr. Elias Sagai. Thank you, but before we sit, I again kindly request you to hold another moment of silence for all health workforce who lost their lives while on duty due to COVID-19, as well as all Ethiopians who lost their lives because of COVID-19. Thank you very much. Be seated. I'm honored and privileged to welcome you all who gathered here and all our members and partners who joined this event virtually through a live streaming at the official opening of the 32nd Annual Scientific Conference and General Assembly meeting of the Ethiopian Public Health Association. With more than 8,500 ever registered members with diverse backgrounds, the Ethiopian Public Health Association is dedicated to enhance its profound contribution and substantial role for the development of the health sector, both at national and global scale. As part of advancing its mission, EPH has been engaged on various public health agendas in close collaboration with different actors, including the government, civic society, and private organizations. Among those, EPH has established long-term partnership with the Federal Ministry of Health, the Regional Health Bureaus, Ministry of Science and Higher Education, HERCA, CDC Ethiopia, the David and Lucy Packard Foundation, various local and international universities, and sister professional associations. The main theme of the 32nd Annual Scientific Conference is renewing commitment to ICPD in the face of COVID-19. Taking the infection prevention protocol of COVID-19 into consideration, our conference this year is conducted in a hybrid mode, both virtually and physically with few people, and lasts for the coming 2 days. The conference will exhibit moderated panel sessions on the main sub-themes of the conference, concurrent sessions of 50 oral and 86 poster presentations, and a General Assembly meeting, among other things. As per the Ethiopian Public Health Association's tradition, annual Public Health Award ceremony will be held this evening to recognize outstanding contributions at different categories to the advancement of public health in the country and beyond. Our members, including public health students, new graduates, young and senior researchers, and instructors in the higher learning institution and sector policymakers that are distributed all over the country, are all the prides of the association and believed to be the base of EPH's strategic existence. On the behalf of the executive board and myself, let me thank all these members for their unparalleled voluntary contribution to the growth and strength of the association and the advancement of public health. Excellencies, ladies and gentlemen, as we all know, our world has been challenged with the COVID-19 pandemic for more than a year. To this end, we, as professional association, shall provide quality information to our members, the public at large, and also contribute evidence-based approaches to the Ministry of Health so that it makes appropriate and timely decisions. This year's moderated panel sessions focus on COVID-19 pandemic in both the main and sub-themes, the main theme and sub-themes of the conference, and important recommendations are expected. Last but not least, we strongly believe that we need to work more in order to develop an institutional capacity so as to strengthen the member base at all levels, both in rural and urban settings, and help to foster our members' contribution to the advancement of public health. To this effect, Ethiopian Public Health Association would like to capitalize on its solid cooperation experience among members and also partners. At this juncture, please allow me to thank the following institutions for their continued efforts and sincere contribution to bringing this annual conference a reality. The Federal Ministry of Health, UNFPA Ethiopia, Encompass Ethiopia, Bunna International Bank, Addis Ababa Regional Health Bureau, the David and Lucy Packard Foundation, EPHA Secretariat, members of the Scientific Committee of the 32nd EPHA Annual Conference, members of the Award Committee of the 31st Annual Conference, and many others. But before my concluding remarks, please join me in appreciating the health workforce who are serving at COVID treatment centers by standing and clapping for another 30 seconds. Thank you. Please be seated. I would like to end by expressing my best wishes for a most rewarding scientific conference and General Assembly meeting. I hope this will contribute to advance evidence-based decision-making on public health issues and foster shared understanding on the current status of the association as a strategic gateway to the way forward. I await your conclusions and recommendations with much interest, as I am sure they'll contribute greatly to boost our common goal. Thank you for joining us in Addis Ababa and for your contribution at various capacities, and for those who are attending virtually all over Ethiopia. Thank you very much. And as Dr. Addis said, I'm not also advising you not to forget to avoid handshaking and hugging. We encourage more frequent hand washing than usual. God bless Ethiopia and its people. Thank you very much.
Thank you, Dr. Matike. I will now call upon Ms. Denia Gail, country representative of UNFPA. Next. Okay, let me call upon Dr. Buremia Sambo, or WHO representative to Ethiopia.
Thank you, moderator. I must say that I'm not Buremia Sambo, but I'm representing him, Dr. Esther Mary Acheng. Her Excellency, Dr. Leah Tadesi, our strong sister and Honorable Minister of Health of the Democratic Republic of Ethiopia. Dr. Mitike Mola, President, Ethiopia Public Health Association. Esteemed representatives and colleagues from the Ministry of Health and colleagues from other government agencies and members of the Ethiopian Public Health Association. Distinguished head of agencies and representatives from the UN agencies, representative from the Africa CDC and the US CDC, represented by Dr. Friot, also my strong sister from CDC. Tenisling, Edemna Walachu, and good evening. It is indeed my pleasure to join you today to open the 32nd annual conference of the Ethiopia Public Health Association. I'd like to thank the association for inviting WHO to be a part of this August conference. The theme of this year's conference, renewing commitments to ICPD in the face of COVID-19 is particularly relevant to all of us. As we all remember, more than 25 years ago, the International Conference of Population and Development moved the narrow policy focus of policy dynamics and drew our attention towards the broader sexual and reproductive health needs of people, especially women and girls. It further advocated that gender equality and empowerment of women is critical to achieve progress in any development. Although today we are proud and we continue to celebrate the progress that has made since then, unfortunately, the progress since 1994 has been uneven, and too many people are being left behind. For instance, in a report released earlier this week, WHO and partners estimate that violence against women remain devastatingly pervasive, and it starts when they are very young. Across their lifetime, 1 in 3 women are subjected to physical or sexual violence by an intimate partner or a sexual violence from a non-partner, a number that has remained largely unchanged over the past decade. The COVID-19 pandemic has unfortunately further aggravated the situation and revealed the fragility of our social fabric. Stay-at-home orders imposed to protect the public and prevent the spread of COVID-19 infection has sadly shown that for many women and girls, home is not a safe haven. Further, the COVID-19 pandemic has resulted in general disruption of sexual reproductive health and rights services. In Ethiopia, our home here, skilled deliveries and immediate postpartum family planning have decreased by 28 and 67 respectively during the pandemic, compared to the same month in 2019. Overall, the number of clients presenting to family planning was reduced by 27%. Safe abortion services and comprehensive abortion care were reduced by 16% and 20% respectively. Ladies and gentlemen, unless we respond urgently with smart and bold responses, COVID-19 will jeopardize the Sustainable Development Goals and risk reversing decades of progress on poverty, health, and education. We must act swiftly and in solidarity to build back better, with a strong focus on inclusion, equity, and resilience. In this context, the 3 sub-themes of this year's conference, SRHR, ending gender-based violence and demographic impact of COVID-19, are extremely relevant. Further, as the conference brings together EPHA members and experts with diverse backgrounds in public health, social, and biomedical science, I am sure the conference deliberation will stimulate the thinking of how to mitigate the risk from COVID and start strategies and efforts to regain the lost grounds. I am also confident that the conference will provide a great opportunity to reflect on progress made in Ethiopia in advancing sexual and reproductive health, and also to identify and address remaining challenges. As WHO, we remain committed to support Ethiopia to achieve the Sustainable Development Goal targets by providing the best evidence and normative guidance for achieving sexual and reproductive health through universal health coverage. I would like to underline our commitment to ensuring that no one is left behind and our focus on reaching the most vulnerable, the most disadvantaged, and the poorest. Through our continued commitment to sexual and reproductive health and rights, WHO will strive to empower women, protect and promote the rights of all, and ensure a healthier and more equitable world. Ladies and gentlemen, COVID-19 has been a wake-up call for all of us. It has laid bare our vulnerabilities and clearly highlighted the need for additional financing and bolder policy options for health, nutrition, education, and other essential services. Today, more than ever, we rely on experts, such as the members of the Ethiopian Public Health Association, to provide the accountable leadership and share the evidence and wisdom to successfully guide policies and investment in health and development that would serve millions of lives. We also depend on the experts to provide women and girls the services they need and yield economic benefits. With these words, I would like to wish the 32nd Annual Conference of Ethiopia Public Health Association a huge success and look forward to hearing about the outcomes of the deliberation. Betam Amaseginalo. Thank you very much.
Thank you so much. I would like to thank WHO for raising these important issues. As you can see, the team is renewing commitments to ICPD in the face of COVID-19, and we all need to look at our girls to work for women and girls, and the panels tomorrow will also highlight family planning, SRH, and GBV in the face of COVID-19. I will now call upon Dr. John Kengasong, Director of Africa Center for Disease Control and Prevention.
Your Excellency, Minister Leah Tedise, Minister of Federal Democratic Republic of Ethiopia, Your Excellency, Dr. Mola, President, Ethiopia Public Health Association, and Vice President, University of Addis Ababa. I hope I got it right. Excellencies, Head of different UN agencies in Addis Ababa, Your Excellencies from Ministry of Health of Ethiopia, distinguished colleagues, ladies and gentlemen, and let me join my previous speakers to hail our frontline responders who have done remarkably well as far as the COVID-19 pandemic is concerned. First and foremost, let me bring you greetings from John Nkegason, who actually made plans to be here. But of course, we all know the unprecedented nature of the COVID-19 pandemic, which has prevented him from being able to attend this in person. And he has asked me to convey his goodwill messages and wish this particular 32nd scientific conference of EPHA a successful outcome. So Having said that, I will quickly go through his messages, his goodwill message for this particular 32nd EPHA. So let me start by saying that the theme for this particular 32nd EPHA is not only timely, but it's also quite relevant, looking at the fact that the COVID-19 pandemic seeks to erode the gains, the progress they have made in the past 25 years as far as women's reproductive health and rights are concerned. And in our own capacity as Africa Centers for Disease Control and Prevention, we have tried to see what is it that we can do to try to mitigate the impact of this COVID-19 pandemic on our sexual reproductive health and rights. And in that regard, we've done a couple of things. So, Your Excellency, permit me just to highlight some of what you have put together to make sure to mitigate this impact of this COVID-19 pandemic as much as possible. First and foremost, we have worked with partners to make sure that in building back better, we try to address the unique nature of sexual reproductive health and rights by making sure that as we move forward with review and the revision of our workforce or public health workforce development, we capture reproductive health epidemiology as an essential part of going forward. And in this regard, we are working with the Association of Schools of Public Health in Africa to make sure that this is properly and correctly reflected in our curriculum. We have also tried as much as possible to mobilize funds to support this. One other thing that we have also done is to ensure that we support research that seeks to unpack the different impact of this COVID-19 pandemic on our girls and women. Another thing we'll be able to do is the aspect of COVID-19 vaccine. As we are all aware, that is the greatest challenge as far as responding to the COVID-19 pandemic today is concerned. I'm sure we have all heard of issue of equity, we have heard of issue of affordability, we have heard of issue of moral catastrophe if starting part of the world is left behind. So what we have done as Africa CDC is to ensure not only equity, but also affordability. We want to ensure that each and every member state, irrespective of our ability to pay, you have access to this COVID-19 vaccine. We have also tried to empower our member states by way of issuing different guidelines. And one of these key guidelines is a guideline on continuity of essential health services. My colleague from WHO has given us a lot of statistics in terms of what has been the impact. You know, in fact, she actually tried to quantify the impact of this COVID-19 pandemic on the different sexual and reproductive health rights, ranging from antenatal care, you know, to childbirth services, to access to family planning, and so on and so forth. So what we have done is to issue guidelines to support our member states to make sure that as much as possible, we mitigate the impact of this COVID-19 pandemic on those key essential health services, like the maternal and child health. Additionally, we have also provided a guideline that seeks to address access to mental and psychosocial support, you know, because we believe that one of the underlying issues for this gender-based violence has to do with mental health and psychosocial support. And one thing we have been able to do is not only to issue the guideline, also to build the capacity of our member state, you know, so that as much as possible, they're able to address some of these issues as we respond to the COVID-19 pandemic in our respective member states. So, colleagues, distinguished excellencies, ladies and gentlemen, I would like to conclude by saying that the COVID-19 pandemic has actually brought up an opportunity for us to talk of a new public health order. And what is it that we are doing as Africa CDC? One is to make sure that we begin to build local manufacturing capacity. Local manufacturing capacity in terms of being able to build the capacity for vaccines, being able to build the capacity for diagnostics, and being able to build the capacity for therapeutics. And this includes all those, the different medical equipment or supplies that will require us to actualize the dream, the vision that was set up 25 years ago in Cairo when the ICPD was first launched. And you also agree with me that without the local manufacturing capacity, you cannot talk of ensuring a security of 1.2 billion population. So that is one. Number two, we also need to begin to talk of adaptive workforce development, and this affects each and every one of us. And I'm happy that the president of EPHA is also the vice president of University Addis Ababa. Reproductive health epidemiology needs to come up strongly, and if you do not use this opportunity to talk about it, if we do not use this opportunity to lay the foundation, a very strong foundation for this, I'm not sure of which opportunity we are waiting for to do that. So thank you, Your Excellency, for being here, and that is part of Africa CDC message for you. Then the next thing is partnerships. We know that we are in resource constraint setting. We need to work with partners. We know that a lot of partners who are in the space, but this is an opportunity to begin to come up with what is the best partnership arrangement that will allow us to be able to respond to our own priorities. Response that is going to be locally contextualized. So it is a perfect opportunity for us to begin to do that. So we thank our partners, but again, we need to begin to work together in such a way that we contextualize whatever approach that we are talking about. Again, this is also an opportunity for us to strengthen our health systems and to strengthen systems for health. So it's again an opportunity for each and every member state to begin to have what we call the EPHA equivalent in each and every member state, because all these are outlined need to be properly institutionalized. And the only way you can institutionalize that is to have this EPHA equivalent in each and every member state. And for those member states who already have one, we continue to work with them to make sure that we strengthen those capacities within their disposal. So this is what the new public health order seeks to address. Your Excellencies, distinguished colleagues, ladies and gentlemen, to close, I would like to wish this August gathering, the EPHI, at the second scientific conference, a successful deliberation as we seek to unpack the women health, women reproductive health and rights, to begin to see how do we emphasize the need for this particular agenda to be a top priority as we try or as we seek to build back better and stronger from COVID-19 pandemic. Thank you, and we're grateful for EPHI for the invitation to Africa CDC to be part of this, and we are with you throughout the 3 days of this conference. Thank you. Amaseginalo.
Thank you. We have been given a lot of assignments to come out stronger from COVID-19 in terms of SRHR in this country, and that's a tall order for EPHA, and we, through the next 2 days, we will really work towards that, and we will see what change we can bring, what issues we will raise and discuss over the next 2 days. We hope that everyone will be staying with us for these next 2 days. I will now call upon Mr. Stephen Becknell, Country Director of U.S. Center for Disease Control and Prevention. Thank you.
Thank you, Dr. Qudus. As you can see very well, I'm not Stephen. My name is Frewat, and I'm representing the US CDC on behalf of Stephen Becknell. Couldn't be here due to other commitments. Ladies and gentlemen, good afternoon once again. Your Excellency, Dr. Liat Addis, Ministry of Health of Federal Democratic Republic of Ethiopia, Dr. Yohannes Chala, Head of Addis Ababa City Administration Health Bureau, respective representative of WHO, Dr. Esther, respected representative of Africa CDC, all other esteemed partners, Dr. Meteke Mola, EPHA President, dear EPHA staffs, members, distinguished guests, and friends. First of all, on behalf of US CDC, I would like to express my gratitude to the Ethiopian Public Health Association leadership and the annual conference organizers
for inviting CDC in this event and for making ICPD a theme of the conference. Renewing our commitment to the ICPD promise is acknowledging sexual and reproductive health as a fundamental human right and emphasizing that empowering women and girls is a key to ensuring the well-being of individuals, families, nations, and our world in total. Over the last many years, a lot of progress has been made in improving the quality and access to key reproductive health services, including the improvement in modern contraceptive services, in ensuring access to skilled childbirth attendants, introduction of the human papilloma virus vaccine, and expanded access to the antiretroviral therapy, which has led to a declining incidence of HIV infection and a steep fall in the number of adults and children dying from HIV-related causes. Under the leadership role of the Federal Ministry of Health, US CDC has been partnering with government, non-government partners, and with professional associations like EPHA to improve the quality of HIV/AIDS prevention and care and treatment services to accelerate the country's progress towards reaching the HIV epidemic control. The concerted effort for the last many years has markedly curved down the epidemic and placed our nation to be under the list of countries close to reaching HIV epidemic control. Detecting the remaining undiagnosed people living with HIV/AIDS, putting them on treatment, retaining PLHIVs already on ART to ensure their viral suppression, and breaking further chains of HIV transmission should be the focus area to finish the final lap towards epidemic control. The recent new initiatives, including the support or the collaboration for cervical cancer prevention and control among women living with HIV, and the violence against children in youth survey, and the associated response will further speed up our progress and will also have a huge contribution towards improving the lives of women and children. CDC has a long-standing partnership with EPHA for the last about 15 years in the area of strategic information generation, dissemination, and use. The longitudinal all-cause mortality surveillance project, the PLHIV retention in care prospective survey are some of the recent joint engagements, which has provided a critical source of information to feed the HIV program. Lastly, though a lot has been achieved, many challenges remain to ensure that the ICPD promises are made. With the emergence of the COVID-19 epidemic, which has caused disruption on the provision of reproductive health services, greater efforts are needed to tackle today's challenge and to ensure that a sustainable, resilient reproductive health service provision platform is created in the health sector. US CDC, through the President's Emergency Plan for HIV/AIDS Relief, PEPFAR, will continue its commitment in supporting the Ethiopian government in improving the quality and access to health services, and would like to continue partnering with indigenous local organizations and professional associations like EPHA to ensure sustainability through building local capacity. Finally, I wish you all and EPHA to have a successful 32nd annual conference and a fruitful deliberation through the coming few days. Thank you.
Thank you, Wafreot. I will now call upon Her Excellency Dr. Leah Addis for the official opening. Your Excellency, we know you are traveling. We know you must be tired, but I would like to thank you in the name of all our members for prioritizing this conference and coming here to be with us. Thank you so much.
Thank you very much, Dr. Addis. Good afternoon, everyone. I would first apologize for my speech will be in Amharic for my international colleagues, and also apologize as you have to speak wearing my mask. ክቡር ዶክተር ምትኬ ሞላ የኢትዮጵያ ጤና አጠባበቅ ማህበር ፕሬዚደንት፣ የኢትዮጵያ ጤና አጠባበቅ ማህበር የጠቅላላ ጉባኤ ስራ አስፈጻሚዎችና ስራ አመራር ቦርድ አባላት፣ በአጠቃላይ የጤና አጠባበቅ ማህበር አባላት፣ our esteemed colleagues and representatives of UN agencies, Africa CDC, other development partners and donors, እዚህ ጥሪ የተደረገላችሁ የተለያዩ የመንግስት ኃላፊዎች፣ እንደዚሁም በአካልና በኦንላይን እየተሳተፋችሁ ያላችሁ እንግዶች፣ ክቡራትና ክቡራን፣ ከሁሉ አስቀድሜ እንግዲህ ለዚህ ለ32ኛው የኢትዮጵያ ጤና አጠባበቅ ማህበር ዓመታዊ ጉባኤ እንኳን አደረሳችሁ እያልኩ በዚህ ጉባኤ ላይ በመካከላችሁ ተገኝቼ መክፈቻ ንግግር ለማድረግ መጋበዜ የተሰማኝን ልባዊ ደስታ በራሴና በጤና ሚኒስቴር ስም ለመግለጽ እወዳለሁ። የኢትዮጵያ ጤና አጠባበቅ ማህበር በሀገራችን የጤና ልማትና አገልግሎት ዘርፍ ላይ እያደረገ ያለው ጉልህ አስተዋጽኦ ከጊዜ ወደ ጊዜ እያደገ መጥቶ ወደ ላቀ ደረጃ በመሸጋገር ላይ ያለ የሙያ ማህበር መሆኑን በሙሉ ልብ መመስከር እችላለሁ። ማህበሩ በአጭርና ተከታታይ ስልጠናዎችን በመስጠት በጤና ፖሊሲዎችና ፕሮግራሞች ዝግጅትና ግምገማዎች ላይ በከፍተኛ ሁኔታ በመሳተፍ እንደዚሁም የምርምር ስራዎችን በማስፋፋት የጤናውን ሴክተር ትራንስፎርም ለማድረግ በያዝነው ጉዞ ላይ ከጊዜ ወደ ጊዜ ያለውን ተጽዕኖና አስተዋጽኦ እያሳደገ መምጣቱ በጤና ሚኒስቴርም ሆነ በአጋሮች ዘንድ ያለው የአጋርነትና ተቀባይነት ወደ ላቀ ደረጃ እንዲሸጋገር ረድቶታል። ይህ ማህበር ከሀገር አቀፍ አልፎ በአህጉራችን በአፍሪካና በዓለም አቀፍ ደረጃ ያለውም መልካም ገጽታና አስተዋጽኦ ከጊዜ ወደ ጊዜ እያደገ መምጣቱ ደግሞ በሀገራችን ውስጥ ጉልህና ጠንካራ ከሆኑት የሙያ ማህበራት አንዱ ማህበር እንዲሆን አስችሎታል። የኢትዮጵያ ጤና አጠባበቅ ማህበር ከጤና ሚኒስቴር፣ ከክልል ጤና ቢሮዎችና በሀገሪቱ ከሚገኙ ከፍተኛ የትምህርት ተቋማት እንደዚሁም ከሌሎች አጋር ድርጅቶች ጋር በጤናው ስርዓት ውስጥ በርካታ የአቅም ግንባታና የምርምር ተግባራትን በትብብር እያከናወነ ይገኛል። ላለፉት በርካታ ዓመታት በተለይም በተለያዩ አጋሮች በተገኘም ድጋፍ ከጤና ሚኒስቴርና ከክልል ጤና ቢሮዎች ጋር የተለያዩ ለሀገሪቱ ጤና ዘርፍ የሚሰጡ የአገልግሎት ጥራትና ደረጃ እንዲሻሻል እያደረገ ያለው አስተዋጽኦ በጣም በጤና ሚኒስቴር ስም እውቅና የምንሰጠው ነው። በተለይም ትኩረት ከምንሰጣቸው አገልግሎት ዘርፎች ስነ ተዋልዶ ጤና፣ የእናቶች ጤና ዙሪያ በተለይ ቤተሰብ እቅድ አገልግሎትን ለማሳደግ በምናደርገው እንቅስቃሴ ውስጥ ዋነኛ የሆነው በተለይ የረዥም ጊዜ ቤተሰብ እቅድ አገልግሎትን በሀገር አቀፍ ደረጃ በማሳደግ ሂደት ውስጥ የኢትዮጵያ ጤና አጠባበቅ ማህበር ከሚኒስቴር መስሪያ ቤታችን ጋር በመተባበር በተለይ በአሁኑ ወቅት በኦሮሚያ የረዥም ጊዜ ቤተሰብ እቅድ ዘዴ የሆነውን ኢምፕላኑን በማስገባትና በማስወጣት ስልጠና ዙሪያ በርካታ ለሆኑ የጤና ኤክስቴንሽን ሰራተኞች እንደዚሁም በጤና ጣቢያዎችና በመካከለኛ ደረጃ ላሉ የጤና ሙያተኞች የክህሎት ስልጠና በመስጠት ከዛም አልፎ ግብአቶችን በማቅረብ አገልግሎቱ በጥራትና በተሳካ ሁኔታ እንዲካሄድ እያደረገ መሆኑ ከፍተኛ ግምት የምንሰጠው ጉዳይ ነው። ከዚህም በተጨማሪ እንግዲህ የመንግስት ጤና ፖሊሲና ጤና ልማት ትኩረት አቅጣጫን በሚመለከት እየተገበርን ያለነው የጤናው ሴክተር ትራንስፎርሜሽን ፕሮግራም ወይም HSTP1 የመጀመሪያ ዙሩን አጠናቀን ሁለተኛ ዙር HSTP2 በዚህ ዓመት ወደ መተግበር ገብተናል። በዚህ የፖሊሲና የስትራቴጂ ቀረጻም ላይ የማህበሩ አባላት በተለያዩ ደረጃዎች ላበረከታችሁት አስተዋጽኦ በዚህ አጋጣሚ ላመሰግን እወዳለሁ። በቀጣይም በቀረጻው ብቻ ሳይሆን በጤና ሴክተር ትራንስፎርሜሽን ፕሮግራም ትግበራውም የላቀ አስተዋጽኦ ማድረግ እንደምትቀጥሉ ሙሉ እምነቴ ነው። መንግስት ትኩረት አቅጣጫው በማድረግ እየተንቀሳቀሰ ከሚገኝባቸው ወሳኝ ስራዎች ውስጥ የጤና ኤክስቴንሽን ፕሮግራም ጥራትን በማሳደግ በተለይም መሰረታዊና ሁሉን አቀፍ የጤና ሽፋን በተፈለገው ደረጃ ጥራት ማዳረስ፣ ለጤና ባለሙያዎችና ሰራተኞች ምቹ የስራ አካባቢን መፍጠር፣ በእናቶችና ህፃናት ጤና ዙሪያ በተላላፊና ተላላፊ ያልሆኑ በሽታዎችም ዙሪያ የተጠናከረ ሁሉን አቀፍ ስራ መስራት ከብዙዎቹ ውስጥ ለናሙናነት የሚጠቀሱ ናቸው። የኢትዮጵያ ጤና አጠባበቅ ማህበርም ላለፉት ዓመታት ከተለያዩ አጋር ድርጅቶች ጋር በመተባበር በእነዚህ የትኩረት አቅጣጫዎች ዙሪያ እንደዚሁም አንዳንዶቹን ስፔሲፊካሊ ለመጥቀስ በአልኮል፣ ሲጋራና አደገኛ እጾች ዙሪያ ተከታታይና መጠነ ሰፊ የሆኑ የግንዛቤ ማስጨበጫ ፕሮግራሞችን ለህብረተሰባችን ሲያስተላልፍ መቆየቱ ይታወሳል። ይሄ ደግሞ ተጠናክሮ እንደዚሁም በስራ ላይ የሚገኙ ህጎችን መሰረት በማድረግ ቀጣይ ተግባራት ተጠናክረው እንደሚሰሩ እንደዚሁም ትኩረት በሚሹ አሁን በስፋት እየተስፋፉ ያሉ ተላላፊ ያልሆኑ በሽታዎችን መከላከልና መቆጣጠር ረገድም የራሱ አስተዋጽኦ እንደሚያደርግ ባለሙሉ እምነት ነኝ። እንደዚህ ባሉ የዛሬው አይነት መድረኮችም ሙያዊ ሀሳቦችን በማንሸራሸርና ልምድን በማካፈልና የጋራ ሀገራዊ ዓላማን በማለም በየዘርፉ ያሉ መልካም አጋጣሚዎችን ለመጠቀምና እየገጠሙ ያሉንን ፈተናዎችንም በጋራ ለመቅረፍ የሚያስችሉ ናቸው። የጤና ሚኒስቴርም ከሙያ ማህበራት ጋር በየጊዜው እየተገናኘ በሚያካሂዳቸው የዕቅድ ክንውን ግምገማዎችና የምክክር መድረኮች በተለይም ፍትሐዊና ጥራት ያለው የጤና አገልግሎት ከማረጋገጥ አኳያ የጀመረውን ስራ የሚቀጥልበት ሲሆን ማህበራችሁን በዚህ ረገድ እያሳየ ያለውን የነቃ ተሳትፎ በዚሁ አጋጣሚ ሳላመሰግን አላልፍም። በመሆኑም በጋራ መድረኮች በተለይ የሚታቀዱ ስራዎች ከግብር ለማድረስና ውጤትም ለማስመዝገብ ሁሉም የማህበሩ አባላትና አጋሮች የበኩላቸውን አስተዋጽኦ እንዲያደርጉ በዚህ አጋጣሚ ጥሪ አቀርባለሁ። እንግዲህ ከላይ የጠቀስኳቸው በርካታ ስራዎች ያልጠቀስኳቸውን በርካታ ስራዎችን ማህበሩ እየሰራ ነው። ማህበሩን ለዚህ ሁሉ አስተዋጽኦዎች እያመሰገንኩ በዚሁ አጋጣሚ ግን ማህበሩንም ድጋፍ እያደረጉና ከማህበሩ ጋር እየሰሩ ያሉ የተለያዩ አጋር አካላትና የተባበሩት መንግስታት ድርጅቶችንም በዚህ አጋጣሚ በእናንተ ስም ከፍ ያለ ምስጋናዬን ለማቅረብ እወዳለሁ። ክቡራትና ክቡራን፣ ሁላችንም እንደምናውቀው ባለፈው አንድ ዓመት በዓለማችን እንደዚሁም በሀገራችን የተከሰተው የኮቪድ-19 ዓለም አቀፍ ወረርሽኝ ለመከላከል ለመቆጣጠር ሊያስከትል የሚችለውንም ጉዳት ለመቀነስ በጣም ብዙ ስራዎች ሁሉን አቀፍ ምላሽ በመስጠት በብዙ አካላት በመንግስት ብቻ አይደለም በሙያ ማህበራት በሁሉም በሌሎች ሴክተሮች ከጤናው ዘርፍ ውጪ ባሉ ሴክተሮችም ሆነ በማህበረሰቡ በርካታ ርብርብ ተደርጓል፣ እየተደረገም ይገኛል። ይህ በሽታ በፈጣን ሁኔታ አጭር በሚባል ጊዜ ውስጥም በህብረተሰቡ ውስጥ የስርጭት ሁኔታውን በማስፋት የጤና ስርዓታችን ምሰሶ የሆኑ እንግዲህ ብዙ ባለሙያዎች የጤና ባለሙያዎቻችን ጨምሮ በርካታ ዜጎቻችንን ለህመም እንደዚሁም ለሞት እንደዚሁም ዘላቂ ለሆኑ የተለያዩ ጤና ችግሮች መከሰት ምክንያት ሆኗል። ያለንን ውስን ሀብትም አሟጠን ለኮቪድ መከላከልና ሕክምና እንድናውል ምክንያት በመሆኑም ወትሮውንም ጠንካራ ያልነበረው የጤና ስርዓታችን ላይ ትልቅ ፈተና ላይ ጥሎታል። በተለይ ግን ዛሬ በኮቪድ-19 መከላከልና መቆጣጠር ተግባር ዙሪያ የኢትዮጵያ ጤና አጠባበቅ ማህበርን ጨምሮ የጤና ሙያ ማህበራት እየተጫወቱ አስተዋጽኦ እያደረጉ ያሉትን ጉልህና የማይተካ ሚና በዚህ ቀን ለማንሳትና እውቅና ለመስጠት እወዳለሁ። በተለይም የኮቪድ-19 አማካሪ ምክር ቤት በማቋቋም የጤና ሙያ ማህበራት ለጤና ሚኒስቴርና በአጠቃላይ በጤናው ዘርፍ እየመራ ላለው ግብረ ኃይል ሲያደርጉ የቆዩት በመረጃ ላይ የተመሰረተ የምክር እገዛና የውሳኔ ሀሳብ አሰጣጥ የምንሰጠው ምላሽ ከመቃኘት አኳያና ጠንካራ ምላሽ እንድንሰጥ የነበረው ጉልህ አስተዋጽኦ በዋነኛነት የሚጠቀስ ነው። ከዛም ባለፈ በተለያየ ሁኔታ የግብአት ማሰባሰብና ድጋፍ የማሰባሰብ ስራም ከዚህ ባለፈ ቀጥታም በሆነ መልኩ የአገልግሎት የመስጠት ስራዎችንም የማህበራቱ አባላት ሲሰሩ ቆይተዋል። በአሁኑ ወቅትም እየታየ ያለው የኮቪድ ወረርሽኝ ስርጭት አሁንም ይበልጥ አሳሳቢ እየሆነ እንደሆነ ሁላችንም እንገነዘባለን። ስለዚህ በቀጣይም እንደ ሀገር ምን አይነት ምላሽ መስጠት እንዳለብን ክትባትም ጀምረናል። ነገር ግን ክትባትና ሌሎቹን የመከላከል ስራዎች በጋራ እንዴት ማስኬድ አለብን የሚሉትንም ከወትሮ ይበልጥ ተጠናክሮ መቀጠል ስላለበት ይህ ድጋፋችሁ እና ይህ በጋራ መስራታችን እንደሚቀጥል በሙሉ እምነት እየገለጽኩ ስለነበራችሁ አስተዋጽኦ ግን ከልቤ ላመሰግናችሁ እወዳለሁ። ለራሳችሁ ብታጨበጭቡ ደስ ይለኛል። በተለይም እንግዲህ አሁን በኮቪድ ወቅት ውስጥ ሆነን ሌሎች መሰረታዊ የጤና አገልግሎቶች እየደረሰባቸው ያለውን ፈተና በተለይም ደግሞ በዚህ ኮንፈረንስ ላይ ትኩረት የተሰጣቸው የስነ ተዋልዶ ጤና እንደዚሁም የጾታዊ ጥቃት ላይ ከዚህ ቀደም ብዙ ፕሮግረስ ያደረግንባቸው ብዙ ጥሩ ውጤት ያመጣንባቸው ጉዳዮች ወደ ኋላ የመሄድ እድልና ተግዳሮት እየገጠማቸው በመሆኑ እዚህ ላይ ትኩረት በኮንፈረንሱ እዚህ ላይ ትኩረት መደረጉ ትልቅ ወቅታዊ የሆነ አጀንዳ ነው። በተለይም እንደምናውቀው የኮቪድ ወረርሽኝ ብቻ ሳይሆን ሀገራችን በተለያዩ ክፍሎች ውስጥ በተለያየ ፈተናዎች ውስጥ የምትገኝበት ወቅት ነው። በግጭቶች በመፈናቀሎች ውስጥ ብዙ ወገኖቻችን አሉ። በዛ ሂደት ውስጥ ደግሞ ዋነኛ ተጠቂና ግንባር ቀደም ተጠቂዎች ሴቶችና ልጃገረዶች መሆናቸው ይታወቃል። ስለዚህ እነዚህን ድርብርብ ፈተናዎች በጋራ የጤናው ስርዓት እንዴት አድርጎ አጠናክሮ ኮቪድን ባለበት ወቅት ላይ አጠናክሮ እንዴት መቀጠል እንዳለበት ይበልጥ የሁሉም ርብርብ የሚፈልግበትና ይህ ፈተና እንደ አጋጣሚም እንደ መልካም አጋጣሚም ወስደን ጠንካራ ስርዓት ለመፍጠር የሁላችንም ቅንጅት ካለበት የተሻለ ሆነን መውጣት የምንችልበትም ስለሆነ ይህ አጀንዳ መያዙና በዚህ ስብሰባ ውስጥም ለዛ ለቀጣይ ለምንሰራቸው ስራዎች ብዙ አቅም የሚሆኑ የፖሊሲና የአሰራር አቅጣጫዎች እንደሚወጡ እርግጠኛ ነኝ። እነዚህንም በጉጉት የምንጠብቅ ይሆናል። እንግዲህ ክቡራትና ክቡራን የኢትዮጵያ ጤና አጠባበቅ ማህበር የራሱ የሆነ ራሱን ከሚያጠናክርበት መንገዶች አንዱ የራሱ የሆነ ህንፃ ግንባታ ላይ በማጠናቀቅ ላይ የሚገኝ መሆኑ አንዱ እንደ ጤና ሚኒስቴር እጅግ የምናደንቀውና በቅርቡ እንግዲህ ይሄ ተጠናቆ ማህበሩ ተጠቃሚ በመሆን የምርምር የአቅም ግንባታና ሌሎች እንቅስቃሴዎችን ወደ ላቀ ደረጃ እንደሚያሳድግ ባለሙሉ ተስፋ ነኝ። የማህበሩ አባላትም ይህን እውን ለማድረግ አስፈላጊውን እገዛ እንድታደርጉ፣ ሌሎች አጋር ድርጅቶችም ይህን እውን ለማድረግ ማህበሩን እንድትደግፉ እያበረታታው መንግስት እንዲሁም ጤና ሚኒስቴር ጥረታችሁ ወደ ውጤት ሲሸጋገር ማየት እንደሚመኝ ብቻ ሳይሆን አብሯችሁም መስራት እንደሚቀጥል በዚሁ አጋጣሚ ልገልጽላችሁ እወዳለሁ። በመጨረሻም 32ኛው ይህ የኢትዮጵያ ጤና አጠባበቅ ማህበር ዓመታዊ ጉባኤ አጀንዳ ላይ ሁላችሁም በንቃት በመሳተፍ ለጤናው ዘርፍ ግብአት የሚሆኑ የፖሊሲ አቅጣጫዎችና ስትራቴጂዎች የምትጠቁሙበት እንደዚሁም ለማህበረሰቡ ጤና አጠባበቅ እድገት ጉልህ አስተዋጽኦ የሚያደርግ እንደሚሆን እየተመኘው ኮንፈረንሱ በይፋ የተከፈተ መሆኑን አበስራለሁ። እጅግ አድርጌ አመሰግናለሁ።
Thank you, Your Excellency, Dr. Leah. EPHA is really grateful for the support that it gets from the Ministry of Health and is always willing and happy to provide whatever supports we can to the Ministry of Health. The next program will be the EPHA award ceremony, and I would like to ask Dr. Metke to come here, and I would also like to invite Your Excellency as a guest of honor also. What did Dr. Alamay? Over there. So the first award is the Public Health Service Award, and I will read the profile of the awardee this year. The awardee is Mr. Warkana Kasi. Mr. Warkana Kasi Tasama is a graduate of the former Addis Ababa University, the Gondar Public Health College, with a BSc degree in public health in 1969. He obtained his MPH degree at the Royal Tropical Institute in Amsterdam, the Netherlands, in 1988. Warkana has also attended 21 short-term courses during his service with the government and UNICEF. His academic and course concentrations were on policy and program analysis and development and strategic planning and health systems management. Mr. Warkana worked for the Ministry of Health, starting as a district administrative health officer in Addis Arkai for 2 years, and then joined the Ethiopian Malaria Eradication Service, where he served as a zone chief in Dredwa and Mekelle zones. He was sent to the Philippines to attend a senior management course at WHO International Training Center in Manila after 10 months of service in Dredwa zone. Upon returning from the Philippines, he was sent to Mekelle zone with special mission of reorganizing the zone's planning, management, and operations, which has been made dysfunctional due to staff and management conflicts. After 10 months of service in Mekelle, Warkana was called back to Malaria Eradication Service headquarters and served as geographical reconnaissance, insecticide spray, and survey section chief, and later was promoted to the level of deputy operations division chief. When the military government took power and started reforming government institutions, Mr. Warkana was called to the Ministry of Health to serve as General Manager of Gojam Regional Health Services. After 3 years of service in Gojam, he was called by the newly established National Children's Commission and served the commission as senior health expert and advisor. His last service in government was with the Ministry of Planning and Economic Development, where he served for 12 years as a team leader and head of Human Resource Development and Social Services Directorate, and later joined the UNICEF Ethiopian Country Office on a secondment basis as Planning, Monitoring and Evaluation Section Chief for almost 9 years. In 2003, Mr. Warkana took an early retirement option and joined the private sector as health development and HIV/AIDS consultant after receiving a professional competence certificate from the Ethiopian Management Institute and license from the Ministry of Planning and Economic Development. He has worked with the Ministry of Health, the ECA, African Union Commission, UNDP, UNICEF, WHO, UNAIDS, UNFPA, and the World Bank. He has provided over 36 consultancy services to these organizations. Mr. Warkana Kasi has also organized and managed 7 VIP and non-VIP international conferences and exhibits with around 5,000 participants. Mr. Warkana Kasi has produced over 24 papers, 3 published, and participated in over 41 national and international conferences and other platforms. Mr. Warkana Kasi has received several honorary diploma certificates for exemplary and outstanding services, and he is the founder and manager of WKT Management Consultancy Service and serves as a part-time lecturer at the Addis Ababa University of School of Public Health and Gambi Medical and Business College in the master's program. He has also served as an external examiner for Addis Ababa University Geography Department. Regarding his voluntary services, Mr. Warkana served for the former Ethiopian Health Officers Association as chair of the Members Affairs Committee, member of the Medical Committee of Ethiopian Family Guidance Association, founding committee member of the Ethiopian Heart Association, member and chair of the 1999 and 2019 Awards Committee of EPHA, respectively, and currently as an executive board member of the EPHA and a board chairman of Gondar Relief, Rehabilitation and Development Association. He also served as a board member of Moses Children's Homes and Ethiopia Malaria Control Professional Association, member of fundraising committee of the World Federation of Public Health Associations and Ethiopian Economic Association at different years. Because of this, he received several honoraria from different organizations, and he is included in the 2000 edition of International WHO's Professionals and award Doctorate of Appreciation Diploma and a number of certificates and appreciation letters for his exemplary service. He won the 2019 PHOS Senior Health Officers Award for his invaluable contribution to the advancement of public health practice. Finally, Mr. Warkana Kase values proactive engagement and innovation, strategic thinking, and doing business in a different way rather than the usual way for achieving effective and sustainable results. Mr. Warkana Kase, please, to the podium. The second awardee for the Public Health Service Award is Professor Malaka Birhan Danyo. Professor Malaka Birhan completed high school at the Bible Academy, Adama, and then joined the then Gondar Public Health College. In Gondar, graduated as health officer with a BSc degree in public health, and later did his postgraduate study in MPH at Leopold Institute of Tropical Medicine and Hygiene in Antwerp, Belgium. He then pursued his study in public health and received a doctoral degree at the Institute of Community Health in Leipzig, Faculty of Medicine in Germany. He also did a short advanced study in public health at Andrea Stamper School of Public Health in Zagreb, Croatia. After graduation, he served as a district health officer at Alamata Health Center and afterwards joined Alert and worked for 8 years as a leprosy control officer in charge of leprosy control program in Eastern and Southern Shoa. Along with the leprosy control program, he was a clinical officer for the management of leprosy patients at the OPD and inpatients in Shashamane Leprosy Hospital. He contributed significantly to the control of leprosy. He also participated as a leader of the Alert Health Team during the 1970 famine and cholera epidemic that happened in northern Wallo. Later, he joined the Gondar College of Health Sciences and worked for 16 years and for 12 years as head of the Department of Public Health. During those years, he contributed significantly to the teaching of public health research and development of community-based public health training. He also played a role in strengthening the Gondar College of Health Sciences and afterwards served as Associate Dean of the Defense University or University College of Health Sciences, and later as Head of Research, Development and Postgraduate Program in Public Health. During those years, he was promoted from a lecturer to the ranks of Assistant, Associate, and Full Professor of Public Health. At present, he is working as a research consultant at Defense University College of Health Sciences and as Professor of Public Health at Sante Medical College Postgraduate Program in Public Health. Professor Malaka Birhan was also a Fulbright Fellow at Harvard School of Public Health. In community and related services, Professor Malaka Birhan served as president of the Red Cross of Gondar region. He was part of a task force that initially drafted the health policy, health service restructuring, and staffing pattern of the primary health service. He also participated in the development of national ethical guideline research curriculum development of innovative medical education, postgraduate program in public health, etc. He has served also as a chairperson of the National Health Council and was member of the scientific and ethical committee that reviewed national research for 4 years. Besides teaching, he has served as internal and external examiner of in public health. During his academic career, he has published 20 research articles. He has received letter of appreciation and thanks from WHO for coordinating the global research in IMCI that was conducted in Gondar. He also received letter of appreciation from Kofi Annan, previous UN Secretary General, for actively participating in UNV programs in Bhutan, and from the government of Bhutan for supporting and strengthening the training of health professionals in the strengthening of health service through health research. Please welcome Professor Malaka Birhan for the award. The next award is the Young Public Health Research Award. The Young Public Health Research Award goes to Mr. Amara Tariku. Mr. Amara was born in 1985 in Koladba town, situated in central Gondar zone, and a historic city where the first public health center was established in Ethiopia. Currently, he is working as an associate professor of nutrition and public health at the University of Gondar. Amara is also a PhD fellow in public health as of 2018 at the University of Gondar and at Addis Continental Institute of Public Health, a joint PhD program. He earned his master's in human nutrition and BSc in nursing at the University of Gondar in 2008 and 2013, respectively. Since his career as an academic as of 2013, Amara has been teaching different nutrition and public health courses to undergraduate and master's students at the University of Gondar. As a guest instructor, he had been teaching and advising research work of postgraduate students at different national universities such as Debre Marcos, Hawassa, Bahir Dar, Jijjiga, and the Jijjiga universities. Amara was coordinator of the postgraduate programs at the Institute of Public Health from 2015 to 2016. and he was head of the Department of Human Nutrition from 2016 to 2018. He was chair of Curriculum Revision Committee for Postgraduate Programs in Human Nutrition in 2018. Regarding his research experience, he has investigated different public health problems, especially that of maternal, child and adolescent health and nutrition, and neglected tropical and infectious diseases. He has published more than 53 original articles at different international journals. Currently, he is a principal investigator of a 5-year research project aimed at investigating the effect of health and nutritional attributes towards birth outcome and child growth and development. In addition to some other research projects, he won a PhD fellowship grant funded by Bill and Melinda Gates Foundation under a fund received by the London School of Hygiene and Tropical Medicine. Amara was a research team member of Dabat Research Center from 2016 to 2018, and regional coordinator and consultant researcher for different national and subnational studies. He is an associate editor of the BMC Public Health Journal from 2018 to date, and independent reviewer of different peer-reviewed international journals. Amara has served as a consultant and active contributor in designing the National Food and Nutrition Strategy, training materials for research methods, gender-sensitive nutrition education modules, etc. He was organizing committee for national conferences held at the University of Gondar and actively participated in designing the postgraduate studies action plan of the university, post-graduation studies action plan of the university. Amara has provided different public awareness sessions on maternal and child nutrition through mainstream media. From 2008 to 2013, he served as a BSc nurse at Matama Hospital. In addition to his clinical service, he was supervisor of different public health campaigns. He was the head of emergency and inpatient departments, a member of the hospital management committee, and focal person of Kalazar treatment and therapeutic feeding units. Please welcome Amara Tariku for his award. The last award for today is the Senior Public Health Research Award, and this goes to Dr. Ababa Fakadu. Dr. Ababa Fakadu was born as the youngest of 9 children in a small village in Gondar called Alange, to a farming family that hails from Balasa. His early education, case primary and secondary school, was an itinerant one and included a 2-year spell in the famous town of France, where Ethiopia's maternal family comes from. Well, he claims that he was in class with one of the close descendants of Ethiopian. Ababa Fakadu graduated in medicine from Addis Ababa University and then Gondar College of Medical Sciences. He completed his specialty training in the United Kingdom with a membership of the Royal College of Psychiatrists, and subsequently training at the Maudsley in the United Kingdom, the largest, probably the most prestigious psychiatry training institution in Europe. He also completed his master's, including an advanced training in clinical psychopharmacology from the UK and a PhD from Sweden in clinical psychopharmacology, and his PhD from Sweden. He has worked as a consultant psychiatrist at the Maudsley and as senior researcher at King's College in London before his return to join Addis Ababa University 10 years ago. One of the highlights of his work at King's was developing the first multidimensional model for staging treatment-resistant depression called the Maudsley staging method. So far, the Maudsley staging method is the best and most widely used multidimensional staging model in the world for treatment-resistant depression. The tool was commended by the prestigious F1000 Prime faculty for its simplicity and best predictive utility. His commitment to research developed early on when he was a young general practitioner because of the influence of excellent mentors like Professor Atalay Alam and Professor Dereja Kabada. He was part of the initial team that established the now famous Butajra project on severe mental disorder. He also led the unique Zoai Island project before he moved to the UK for his training. His research interests consolidated since and includes one, improving the understanding and epidemiology of severe mental disorders. In this regard, the description by his research group of the course and outcome of schizophrenia and bipolar disorders has proven globally influential. The report on the long-term mortality of people with severe mental illness that he led is again one of the rarest reports on the subject of LMICs, and the report was instrumental in the development of WHO's multi-level intervention framework to reduce excess mortality in people with severe mental illnesses. Second, developed a pragmatic approach to improve mental health care. He has led several complex intervention projects. Examples include a study among the homeless, community-based rehabilitation approach, and integrated approach to care. The Prime Ethiopia project was the first of its kind and a global example of in offering an effective and scalable integrated care for mental disorders and epilepsy. Third, treatment-resistant depression. Working as a senior researcher at King's College in London, he has contributed to the knowledge base of treatment-resistant depression, including tool development. And fourth, measurement scales. Mental health research relies a great deal on good measurement scales, and he has introduced numerous critical instruments to Ethiopia's mental health research. Examples are the schedules for clinical assessment in neuropsychiatry scan, the OPCRIT operational criteria for research, the longitudinal interval follow-up evaluation charts, the Camberwell assessment of needs, short appraisal schedule in Ethiopia, and the Oslo social support scale, the Butajra treatment gap questionnaire. Ababa Fakadu is head of CDC Africa at Addis Ababa University, a regional medical discovery center of excellence with a network of over 40 institutions, and is responsibility to support capacity building in 24 Eastern and Southern African countries. Ababa Fakadu is also a co-director of the WHO Collaborating Center for Mental Health research and capacity building at the Department of Psychiatry, College of Health Sciences at Addis Ababa University. He is a member of the Royal College of Psychiatrists and has served as the treasurer for the Africa branch. He was a member of the Executive Board of Ethiopian Medical Association, operations manager of the Board of Ethiopian Public Health Association. He has served various panels and advisory groups, Lancet and national commissions, international funding boards, editorial and advisory boards, U.S. Institute of Medicine, and the World Health Organization. He is a fellow of the Ethiopian Academy of Sciences and a fellow of the International Society of Affective Disorders. He is also an African research leader and a prestigious award of the Medical Research Council and the Department for International Development DFID of the United Kingdom, bestowed upon individuals considered to be exceptionally talented. He is a visiting professor at the University of Sussex in the United Kingdom since 2017 and at King's College in the UK and London since 2019. Since his return to Ethiopia 10 years ago, Ababa has been awarded over $40 million in research grant initiatives as principal investigator or co-investigator, with over 200 publications. Over 200 publications, I'm repeating that, it's amazing. Scores with RG scores of 43.04 and H index of 41. He is established as one of the influential scientists globally. Dr. Ababa is married to Dr. Charlotte Hanlon, and they have 2 sons. When he has time to spare, he enjoys watching football, English soccer, and playing karar. Please welcome Dr. Ababa Fekadu to the award. Thank you. Thank you. Please thank Her Excellency Dr. Leah and Dr. Mutike for the award ceremony, and also please thank the awardees for us. Thank you everyone for your attention. Tomorrow's programs start with the panel discussion at 8:30 in the morning. 8:30 is the start time. Everyone, please be here before 8:30. Thank you so much. I really feel honored to be the mistress of ceremony for this EPHA conference opening. Thank you all. See you tomorrow.
የኛ ማህበር